Hi, welcome back to another edition of Casual Conversations. My name is Brenda Bose, social media producer for Columbia University's surgery page, and I am here with Dr. Morrissey. How are you doing today, sir?
Terrific. It's a great day.
So I want to dive right in with you today.
Yeah.
First of all, again, thank you so much. We know you're super busy, so anytime a doctor is able to take time to speak with me, I'm like super thankful
This
and
is
grateful.
great. I love this.
So my first question for you is,
Yeah.
what first interested you in becoming a doctor?
That's a good question. I think people ask that all the time. I kind of evolved to that point. When I was a kid growing up, actually in this neighborhood, my mom used to always say, she wanted me to become a doctor. And I had a little bit of a rebellious spirit, and I used to always tell her that I was going to be a garbage man instead. But then, during college, I realized that, I was surrounded by people that in my family and in my friendships that were really focused on trying to give back to other people and do something of value. I guess I was brought up in a way that the measure of a person is not so much how much money they make or how much treasure they have, but how much they give back to the world. So that for me, the best way to do that, because I had a lot of interest in science, was why not go to medical school and really try to care for as many people as possible.
That's amazing.
So that kind of got me there.
Oh, that's amazing. My next question is, why did you choose specifically Columbia University Medical Center? Because obviously, I feel like a lot of people feel called to the work, but then when you're called to the work, and then it's that actual specific place that you're actually practicing, it's I feel like it's two different things, but it's one and the same.
Yeah, I think that's a great question. I have a couple of answers for that. I was born at Baby's Hospital right here in 1966.
Okay.
And we lived on 173rd Street in Fort Washington when I was a little child. And, they used to refer to this place as Medical Center. They didn't even call it Columbia. But, my parents were immigrant parents, and they always looked up to the medical center as like the center of the neighborhood, like the high place. And so for me, I always tell people that coming to work at Columbia is sort of like a kid who grows up in the Bronx and plays baseball and comes back to play for the Yankees. That's the level of, of importance that this institution had in my family and in me growing up. So that's really why.
So coming back to serve your community in a way.
Coming back, being born here, and being part of such an incredible university. My parents are gone, but I think they would be pretty proud of the fact that I landed at this great institution.
That's amazing. And my final question for you is, what would you say is the most rewarding part of your job?
There's a couple things. I will tell you that when I see patients post-operatively, pre-operatively, or even if they haven't had surgery and we're just kind of following them, continuity of care and developing sort of friendships and almost family relationships with them has been really spectacular. Sometimes you come in and you're having a rough day, things are not so great, your kids are giving you a hard time, and then a patient will give you a hug and holiday wishes or bring you a card or tell you how their family's doing, and you really develop a great bond. So being able to impact them, do something of value. We don't cure everybody, but I think we make people for the most part feel better and have a better quality of life. You combine that with developing a relationship, I think it's an incredible reward. The other thing that I really enjoy, and it's kind of specific to Columbia, is the collegiality, the working with my colleagues. My orthopedic colleagues, my neurosurgery colleagues, people in cardiology, just kind of knowing that you have such great quality people in all different specialties and be able to take a complicated case and work on it from different specialties. And it's tremendously rewarding because we can really approach people who are very complex by working together with top quality people in different areas. So this is a couple of things that really drive me.
That's amazing. Dr. Morrissey, it's been a pleasure to speak with you today, sir.
Thank you.